Hello, my lovelies. I wanted to give you another update. Today I am officially 12 weeks and 1 day pregnant with one baby. Those of you who are new to my channel, welcome. My name is Freya. I am 50 years old. I'm about to be 51 in about a month and a half. And I conceived twins a little more than 3 years ago. Well, that 4 years ago, really. They are 3 now. And I conceived them through embryo adoption when I went to the Czech Republic a few years ago. And this past January, I went to Spain and I conceived one baby. It was a donor embryo, and first transfer again worked out. So today I wanted to give you an update. It's been a while and I apologize. I want to make more frequent videos, but it's been crazy. Number one, the twins they have started their kindergarten. I talked about that. So I've been with them. So it's going to take like another week or so until I'm going to actually leave them there and, leave and then get to work. So I've been there with them, and with Emil, it hasn't been easy because he is very hard-headed. He's not easy to deal with if you don't know him, so he kind of has to learn the process first because they have routines that they do, and first couple days it was really hard for him because I was like, no, I don't want to do this. He wants to keep playing, and then when they said, now we clean up, it's like, no, but I'm playing here. So it's been a little challenging. It's getting better. Today was pretty, no screaming. They did what everyone told them to do pretty much, maybe not right away. So it was good. So that's been a challenge time-wise. I have not been able to get a lot of work done, but I did want to give you an update. How have I been feeling? Okay, I did tell you about the H. pylori thing, and I feel like the pregnancy nausea, the morning sickness, which of course we all know it's not just in the morning, it's pretty much 24/7. I feel like it has gotten a bit better in the past week. However, I still have that stomach pain, which sometimes is so bad, as I still have a really hard time eating and drinking. I have not gained any weight. I actually have lost about 5 pounds since I started the pregnancy. Today, I've been making warm cocoa, like just homemade, just milk, cocoa powder, a little bit of honey, and some cinnamon, because I like cinnamon, just a little bit. And today, I felt like cold. So I have some ice in here, and I made some kind of like a cold chocolate milk. It changes all the time what I feel like I can stomach. And I don't think this is pregnancy related anymore. I think this is now really just, I don't know if it's just H. pylori, but definitely there's something going on in my stomach. I did see my OB last week, and I did have an ultrasound. It was a little bit of a drama, okay? There was crying going on my side, and I'll tell you why. So I got there. I've been seeing my OB for, I think, 14, 15 years. So I've been with him forever. I know him. I trust him. I love him because he's such a oh, this is all a risk pregnancy because you're so old. He always just takes it. He just takes a look, and it's like, okay, this is what it is. Not because he's not about like putting numbers that aren't real, that are maybe just statistics. He tells me about it, but he's like, well, you are you, and you're an individual. I know you kind of know about stuff, and you research a lot. So he never actually used the word risk pregnancy or like high risk or like, geriatric. I never heard that word from him. Then last time I was in the waiting room, and so I saw him, as always, going in the room and out the room, next patient, until it was my turn. And there was also, I saw another man, which I didn't know really what his role was. I saw him walk back and forth there too. And so I was actually thinking, because my doctor is kind of getting a little bit older. I think he's probably around 60, beginning of his 60s or so. And so I'm thinking probably he might be thinking about getting someone else in, because he has so many patients that he might want to then hand off his practice with all the patients in his office, like, to someone else eventually. So that was my thought, which I was right about. But anyway, the assistant, which was a very young girl, and she was new there, she then called me, okay, you can come in this room now and wait, the doctor will be there in a few, as always. Well, then this other guy came in, and I'm like thinking, and then he starts asking me all these questions. He didn't tell me his name. He didn't tell me what he was doing. So I was like, hold on, I think my phone is not straight. Sorry, aesthetics. And then started asking me all these questions, and then also saying, like all about my history, which I'm thinking, why is he asking me all these questions and entering in the computer? My doctor knows all of it. Like, he knows me. I've seen him frequently in the past few years because of all these embryo transfers and all the work leading up to it and all the testing and stuff and all the exams. So he knows my story a lot. He knows about my 2 miscarriages that I had in the past, and he has all that written down. So I'm asking myself, like, why is he asking me all these questions now? Like, took forever. And I'm like, well, I appreciate him taking all that time, but I'm like, why am I having to explain everything now about my history? But anyway, then he started talking about, well, you do know it's a high-risk pregnancy because you're not the youngest. And then I was like, inside of myself, I was like, that's nothing I want to hear. Why are you talking about this? I mean, like, I don't know it, right? But I don't want to hear this now. What I wanted was, come in, have an ultrasound. I want to know, is the baby growing? Is everything good? That's all I want to know. And then if he wants to ask me, do you want any other testing? What do you want done? This is the options. This is usually how my doctor is, like, these are the options. You can say yes or no, whatever you want to do. And I don't know. And then I was like, I just asked him, I was like, so where's Dr. So-and-so, like my doctor? And he's like, oh, because I'm like, I'm confused. I don't know who you are. Like, I don't even know your name, and I don't know what's happening. I've seen him for 14, 15 years, and like, he knows me, and now, like, what's happening? I don't understand. And then I started getting all emotional, and he's like, oh, they didn't tell you? And I'm like, no one told me anything. And so the assistant, she was supposed to tell me that he is another doctor who specializes in, and we call it the fine screening, or the very detailed screening. So he's very specialized in that, like in the ultrasound and the fine diagnostics. We call it fine diagnostic. It's like the fine diagnostics, looking at the is it fetus by then? I think it's a fetus already. And I didn't know. I would have appreciated it. Like, I'm like, oh, that is amazing if there's someone who actually is like a very, specialized in that and can do the fine diagnostics, which is great. I've never had this. Like, it was always just my doctor, no one else. And they just didn't tell me anything. And so I think it's normal for me. And then, of course, I'm pregnant and I'm emotional and it's personal. And I just want to know if the baby's okay. And now they're like, I don't know what's happening. And I started bawling. And I'm like, I'm sorry. I'm not trying to be dramatic. But this is very emotional and personal. And like, my doctor knows all my history. We've gone through all this together. And for me, it's like a very personal thing. He was always kind of like, very pragmatic, which I so appreciate. We vibe. I kind of understand him. And I'm like, I'm very sorry. Then he came back with my doctor and I'm like, sorry, it's okay. It's okay now. They explained. Don't worry about me. I'm not a drama queen. But I was just crying. And I'm like, I just didn't understand. Big deal, okay. And then, poor guy. Then that new doctor, that younger doctor, he took so much time to do the ultrasound with me, which I actually like when it doesn't take a long time because, it's not, the babies don't like it. At 10 weeks, it's still kind of very small. And I side on, I veer on the side of like, just let's be cautious and not do forever until later, not forever long ultrasounds. But he took a lot of time and it just made me very happy. So and I thought he was going to do it vaginally because I was 10 weeks, 6 days. But then he said, oh no, you don't have to get undressed. We're just gonna do it via your abdomen. And I'm like, oh, okay. Because they have a new ultrasound machine that they recently got, and it's like apparently one of the best on the market right now. So I'm like, okay, I'll take that. I don't want vaginal, like if I can avoid it. And it was amazing because it was very clear and everything was fine. And he did not allow me to film it. My doctor always allowed me to film it. He explained to me, oh, because of, legalities, and someone could use it against me in the future if, if I say everything's okay and then maybe then it isn't. And I'm like, okay, I get it. That's a bummer. I'll respect that, but it's a bummer because I've always been able to record all the ultrasounds. And it felt like every time I recorded an ultrasound, it was always positive. For my miscarriages, when I went to the ultrasound, I never made a recording when it turned out like, oh, nothing in there. And I felt like I don't know. But everything turned out more than well. And he took some measurements, like, I don't know, like blood flow and stuff. And he showed me the curves. He's like, that is not normal for a woman your age. You have, like, the numbers are like, you're like a 25-year-old. And I'm like, I don't know, I guess it's a good thing. And then he, in the beginning, he's like, we're going to definitely put you on aspirin. And I'm like, I don't have a problem with that as long as it's like, there's a reason and it's, there's a foundation for it. Like, why should I do it? And then in the end, he's like, put in all these numbers in the computer and he tells me, actually you're like extremely low risk right now. Like with all the things that I just saw, and it's like very low risk. I might still, and he said, we should, if you do the baby aspirin, the low dose aspirin, you should do it before, I think 16 weeks. That's what the studies say. You start before 16 weeks. Otherwise, it doesn't really have the effect of preventing preeclampsia, which it's definitely a good thing. I don't want my blood pressure to be an issue. And it's been fine. My blood pressure has been fine. And I keep monitoring. But, right, and then I kept telling him about the stomach thing, that I'm like, I am so sick, and this, I don't think this is just the pregnancy. This actually started before. I thought it was menopause. It should have gone away then with pregnancy, but it's not. It's actually, now it's adding up with the pregnancy symptoms, and my stomach, it gets so crampy, and it literally, I can feel my stomach harden. Like my stomach cramps up. But for some reason, he didn't take me very seriously. He's like, yeah, we can do this. If it doesn't get better, you can take something against nausea. I'm like, it's not just the nausea. It's just like really my stomach. But he didn't really take it too seriously. Excuse me. So I always have these, I have to burp a lot, and the burping and the belching, it's like, I always have this, and it's my stomach. I can locate it. My digestion is so normal. See, again, it's there's like air coming up all the time. So it's definitely my stomach. And I think what I want, and I know it's not, like, there are ways to do it in pregnancy. I need what is it called? An endoscopy, like for your stomach. I don't know what it's called, like not colonoscopy, but like a stomach where they, put it down through your throat, which that's why you need to have some anesthetics going on. You don't have to be put to sleep 100%, but there are ways to do it for pregnant women. I have read it, and they say you can do it. You just need they need to not fully sedate you, but they just need to, like, locally, to where you don't have that urge to choke the thing. I think that's exactly what I need, and I'm gonna, tomorrow I have an appointment with my midwife. I'm gonna tell her again, and then I'm probably just gonna call my general practitioner and our family doctor, and I don't know. He's a very natural guy too. That's where I go. And my doctor basically doesn't really know me because I have not even gone there really for years. And he has seen me maybe 5 times this entire 15 years that I've lived where I live. And yeah, but I really need to do something. I can't anymore. It's like, it's debilitating. That stomach pain sometimes. I cannot eat properly. I get so nauseous suddenly. I do throw up, not every day, but there was one day, one single time where I threw up twice in one day. But other than that, sometimes I'll go 2 or 3 days without throwing up, and then, sorry for the TMI, but it's just, and then I'll I don't know, it's been a couple days now, but yesterday almost, but I suppressed it so hard to where I'm like, nope, 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 because it was right after I ate. I'm like, no, 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 no. This food has got to stay in there. So I'm trying my best to keep the food in, but today I didn't eat much. And I wish I even would want to eat. I don't even want to eat because nothing sounds good. Nothing feels good. It's hard. Like, I wish I had an appetite, which I don't. I'm making myself eat because I know I have to eat something. But every time after eating, my stomach feels so bad and it's not fun. So I need to do something about this. And if it's just the H. pylori, but I think I really need this. They need to take an actual look at my stomach to see, is there damage already? Is there like a chronic thing? Because I feel it's so painful. It couldn't just be some bacteria, like that might be part of it. I have always eaten very healthy food and for years, and everything I read, it's like, oh, these factors and those factors, maybe stress, because definitely in the past few years with the twins, that's physically stressful. I wasn't like mentally stressed. Well, maybe too, because, like running after twins, it can be very, very stressful. Maybe that has to do with it. But there are no other factors that would put me at risk, for like anything autoimmune or like also these breakouts that I've been having. I read that it could also be because of H. pylori or stomach issues. So I think that's what my hormones seem to be normal. I don't have any increased, white blood cells or anything. There are no markers, like, because I had everything like very detailed testing. There are no markers for any like infections or anything in my body going on. But there's got to be something. It's in my stomach and I can feel it. And the baby now, I'm going to show you my bump because it's really starting now. The baby seems to be doing great. And it was even 2 days ahead, it measured 2 days ahead when I was at the ultrasound, which, at this point is like plus minus 2-3 days. It's normal. But it measured big, which made me happy, which means, because I was a bit worried, it's like, I'm not eating a lot and I have lost weight. But it's true, the baby takes what it needs. If it's a healthy baby, it gets the nutrients. So I try to take my supplements and, trying to not having to throw up right after I take supplements, trying to make sure it's all absorbed. And I hope, it's not good if something is happening in the stomach because that might affect nutrient absorption. If the H. pylori, that could really affect it because you might not be able to absorb all the nutrients, which is not good. So yeah, other than that, I have not been sleeping well because I wake up at night and then sometimes my stomach hurts really bad. And that's the main factor right now. That is the number one factor. Other than that, I feel great, which, how can you feel great if you're in constant, like your stomach is always hurting, you're always kind of on the verge of being nauseous, and then in between there are those, like waves of, I think I have to throw up. It's really bad. And then I can tell it's my stomach also when I lie on my left side, the stomach is a bit more toward the left. Lying on my left side at night is so bad. On the right side is better. And then on my back, interestingly, when I'm flat, it's much better. When I pick up toys or anything on the floor, which, you have twin toddlers, there's a lot on the floor all the time, it kills me. Just bending over pushes on my stomach. And if anyone pushes on my stomach, it's like, ooh, it's so bad. And I feel like this is probably the worst I have felt in my life. And it is not just related to the pregnancy, but it's all adding up now because it's a lot of work for my body to be pregnant, but it's also just dealing with this, whatever it is, not good at all. Need to fix it. I'm gonna have this checked. I'm so excited. next ultrasound will be actually already in 3 weeks, less than 3 weeks, because he wants to see me every 4 weeks. So I have my next appointment at the end of April, right after Easter, and my mom still doesn't know that I'm pregnant because I don't want to tell her over the phone. I want to tell her personally, but I haven't seen her since her birthday, which was February 21st. So we were there that weekend, and ever since then I haven't seen her. I thought she would come visit us for a couple days before Easter, but now she couldn't make it. But she will be here on Easter because I've told her on the phone a couple times, oh, I have a surprise for you when you get here. So she probably thinks it's like something that I bought or something that she's gonna get, because we didn't have a birthday present, and I told her, oh, I have something for you, which I did. I had some really beautiful photos that we printed out of the kids and all, and we made this booklet. But the main surprise is gonna be that she's gonna be a grandma again. So I don't know how she's gonna react, of course. You know, I'm 50. It's not the same that when you have a daughter that's 25, that's married, and that's like, oh, now I'm gonna have a baby. It's like what's expected. This is, of course, very much not expected. I'm about to be 51. I already have 3 kids, and I'm not married. So it's like, she's not gonna worry about me, but she's gonna be like, whoa, you're gonna do this to yourself. Whew, it's a lot. She knows I can, you know, she's like, do whatever feels right to you, and I'm happy, and I will support you, and she'll be happy. But of course, it's gonna be a bit unexpected, and it's gonna be maybe a little shocking. Also, that I'm already that far into it. You know, I'm gonna be, gonna be more than 14 weeks. I'm gonna be in my 15th week when she gets here. So it's, you know, it's not like forever waiting anymore. It's like in 6 months the baby's gonna be here, basically, in less than 6 months. So October 15th is my official due date. And again, now, like, my stomach sometimes, you know, in the middle when I'm talking, sometimes it's like, it's almost like it's pushing up something. It's trying to push up, and then air wants to come out. And then when I actually burp, sometimes I burp so much air, but afterwards it feels so good. Okay, I'm gonna wrap it up because I have actually so much work to do. Thank you so much for watching, and I'll try to update you whenever I can, but I just, there's a lot going on. Be blessed, and I'll see you soon. I almost forgot I wanted to show you the bump. Let's see. So I've been wearing wide stuff, so I feel like the top is really like the bloating, the stomach, and but this, I think it's really starting to show. Let's see if you can see. It's really starting to show now. So, oh, and I have stopped taking the progesterone and the estrogen. I kind of faded it out last week, and everything's fine. So there's a little bit of flab here, of course, but I feel like this is definitely, and again, the burping, this is starting to be the baby bump, which I'm still kind of trying to hide when I'm out there, because I don't want everyone asking. It's like, oh, what's happening? They're gonna notice eventually, but that's the baby bump.